Hey parents, Dr. Tony here, and buckle up because this is a big one. This week on the Experience Miracles podcast, we're diving into one of the most important, most timely topics for parents, providers, and really anyone who cares about kids and their future, and that's health, freedom, and informed choice. But everyone, this conversation was so packed with truth, wisdom, and action steps that we had to split it into 2 episodes. Yeah, it's that good. And today is part 1, where I sit down with the amazing Leah Wilson from Stand for Health Freedom. Leah is a mom, an attorney, and one of the fiercest all-in advocates I know for parental rights and protecting our ability to choose what's best for our families. In this first episode, we'll get into the why behind health freedom, why it matters so much, what's really at stake, and how easily those freedoms can be lost if we're not paying attention and taking action. And then in part 2, we'll go deep into the what you can actually do as a parent to get involved and make a difference. So whether you're new to this conversation or you've been following Leah and Stand for Health Freedom for a while, this is a 2-part series that is perfect for you. Let's jump in and get fired up. Welcome to the Experience Miracles podcast, where we help parents find hope, answers, and drug-free help to overcome your child's chronic health challenges. I'm your host, Dr. Tony Ebel, and I'll be sharing my experiences as both a dad and a doctor on every episode. I can take the latest science and neurology of healing and break it down in the most simple and relatable way possible. We'll take on the toughest topics and answer your biggest questions through interviews with other amazing parents and leading experts, leaving you with practical action steps that you can take to help your child heal and thrive. It's time to expect and experience miracles. Let's get started. Okay, Miss Leah. Well, they just got done listening to your fantastic introduction, which, you don't even know what I said about you effectively, right?
You didn't have to introduce me.
Yeah,
no big deal.
It's just on, which is what I have been so excited all day as we get ready to do this interview, because Leah, you just have stepped into a space that I think like I really mean that, millions of parents inside in their gut, they're like, I want to go forward and speak this truth and stand up for health freedom and be a voice. I have a voice inside here. The medical system, did everything they could to squash it and shut it down and silence it. And sometimes the more they push down against that voice, you want to rise up and use that voice. You have. Your entire organization incredibly, impactfully has. So take us back to the origin story. I would assume that there's not a singular thing, but I'm guessing there's a multitude of things, but then there was probably one that just said, okay, it's time to do this. So where did you get your start in this incredible work?
Absolutely. I mean, there's definitely a single impetus for dedicating my entire life, except outside of motherhood and being a wife, to health freedom advocacy. But obviously there was a journey that got us there, which is insane. You look back at timelines and you think this is nothing short of divine. And this is one of the few stories in my life where I'm like, God, I mean, I couldn't have written this, so it had to have been you. That, my passion for law was because of kids, was because of children's health, was because of foster care and the inadequacies of that system. Went to law school. My husband's a natural health chiropractor, fellow chiropractor. And so natural health and law were my world. I practiced big law, complex litigation, Beth Company cases. And then in 2018, we were prepared to take our next foster care placement. And we were up for relicensure. So we had lapsed for a year because of another birth in our own family. And so you have to relicense and go through everything all over again. And it's a very long process. It takes like 6 months with all of the continuing education and the hoops they make you jump through. And the day before we were prepared to take our next placement, I got a letter from the Indiana Department of Child Services saying, we need your vaccine records for your biological kids. And I said, oh, you have my letter.
For your biological kids.
Right. For Isaiah and Samuel, for my boys. And I said, oh, you have the letters. You have the religious exemptions. I'll resend them. And at that point in time, I was not tipped off to anything being weird.
Because you had made one round through this system, right?
And I'd been through, college and everything. And you submit your letter and the administrator tells you this isn't adequate. And you say, oh, yes, it is. And they say, oh, okay. So that's what I was thinking. I was like, this is an admin that doesn't know my letter is adequate. So I said, here's the letters again, religious exemptions. And they came back and said, no, this doesn't work anymore. And I said, oh, wow. And fought it all the way to the top. And
anymore.
they were now interpreting, and I said, what new science since my last placement? What new law?
Right.
What's changed?
Boy, can I just pull there for a second, then you keep going. Those are two very valid questions. What new science? What new law? And most of the time when they make these new interpretations and alter reality even further, none on either, right? But those are great questions.
It's agency power, which is what we're dealing with right now.
You sure are.
The entire conversation. And all they could show me was they were taking a small regulation, which is a rule that the agency makes, the Department of Child Services, that says if anyone in the household is a threat to the welfare of the foster children, then you're not qualified. You're not qualified. So I said, okay, this is crazy. This makes no sense that I know for a fact there are kids sleeping on the floor at the Department of Child Services tonight in my state of Indiana, in central Indiana. Yeah. Yet you're going to say that we are not a safe and loving home for this child.
And in fact, they're going to they are defining you as a threat then.
My healthy children,
Holy goodness.
There's no current outbreak. There's no evidence my kids are not healthy. They're healthy kids. Yep. And I said, all right. And I admit it hit hard at that time, but because it was our soul. I mean, we loved these kids.
Your life.
And at that time, Nick and I looked at each other and we said, this is too big to fight, but it's too big not to fight. So what are we going to do? And so I dove full time into just health freedom advocacy and covering the measles outbreak at that time. So 2018, 2019, there was also a measles outbreak, every few years.
All about it,
And
okay, can I take you back to that question for a second? Okay, because I think, truth be told, goodness graciously, I've been there with our family in some of these, very, very catalyst moments in life. There is that question. There's that quantification question as to, oh my goodness, this is so huge. How would we take this on? But then there's that same question or, follow-up question, which is, this is so vital. How do we not take this on? So just right there in that space, if you can think back to that moment, what were the action steps? Like where, I don't even know how to ask this question. Like what first moves did you make? Is that where you started getting the measles thing? Or
so you want to hear the details?
Yeah.
I mean, it's
because I know that God, I know that OMG, literally, you mean that you're down on your knees, you're praying to God, like I have to take this on / I can't take this on / I have to take this on. So what were those first moments of action?
Mm-hmm. And, the big question is what difference can I possibly make?
Yeah.
And the second question is, where do we go from here to even make a dent in these nonsense policies? Knowing what we knew, this policy made no sense. And I wasn't the one being hurt. My husband, my kids, we weren't the ones being harmed by the bad policy. It was the most vulnerable children in my community were the ones being harmed, the ones that needed homes that night. So it was kind of crazy because my first inclination was call Dr. Joel Bohemier.
Okay.
And so I pick up the phone. I don't ever talk to him. It's my husband.
Right.
It's my husband's mentor.
Yeah, totally.
So I pick up the phone and call him and he says, we ought to call Sayer. And so all three of us are talking and somehow this just came together. And during that, Sayer was like, well, we need to cover what's currently happening. Come on to the Alliance for Vaccine Awareness, which was this repository of every scientist, attorney, virologist, immunologist, mom, journalist, researcher that had done anything in the space of vaccine awareness was like here in this meeting room. And that was my 10,000 hours. I had been in advocacy.
My goodness.
I could tell you so many stories about
2 phone calls, to simplify it for the sake of simplification. Because parents, what I just learned right there, and I was so excited for this podcast interview because I knew I was going to learn so stinking much from your story and your journey and your brilliance. I mean it. I knew it. I told you ahead of time. I was like, I've kind of literally intentionally stayed in the dark about the details of your story until we could have this conversation because I knew there was going to be power in the entirety of the story, but I knew there was going to be extra power in the details. Because I think for us parents and parents that are listening, we want to simultaneously see the big picture of the impact we can make. But most often we're just frozen by the first step. We just don't know who to call first. So you called one mentor who knew Sayer. Now you got to say who that is, because I think a lot of our audience does, but Sayer is Mm-hmm. Can you explain just give the more details on fire?
Yeah. So Sayer G, he had this base camp, this meeting room for everyone who cared about this issue, but he started greenmedinfo.com, which is the largest natural health database for natural medicine studies. So the largest repository. And
it's been happening for research. 20 years? 15, 20 years? Okay. Mm-hmm. And so you got connected there because you needed to get somewhere with someone to get something done. Mm-hmm. And within a connection. And that's what I was trying to draw out there. Everybody out there, you do know a friend, you do know a doctor, you do know a mentor, you do know someone you can call who knows the next someone. And usually it literally is just one. That's how God works. Mm-hmm. He's usually got that repository, that place to make an impact, just one or two steps away. It might feel like in your heart and your soul, oh, that's so far away. And it's actually a lot closer most of the time than it is. Okay. So now you're in with this crew.
So, yes. So I just start covering the measles crisis. I'm watching what's happening. At that point in time, Congress was holding investigative hearings, and who were they interviewing? Anthony Fauci, who was lying. Surprise, surprise. And it was so clear that there were huge amounts of people that cared about this vaccine issue, about medical mandates, period. But their voice, they needed to find their voice in it in a meaningful way, because it's really disorienting to have all these different reasons that you care about the issue with all these different data points and all this different information. And it's, who do I tell about this and what message is compelling and why do they care? And there's really 4 core messages that the narrative hangs on. And that's vaccines save lives. Okay. The science is settled. Religious exemptions are being abused, and the unvaccinated are a threat to the...
Boy, that third one, I think a lot of people, if they were to make a short list, they might forget about the third one. That, you know what I mean? Like if we were to look at, okay, how do they interpret the world? It's those 4 things. 3 out of that, I think, like if you're in this issue at all, you're aware that they kind of play those cards. Well, they mistakenly play those cards, or overplay those cards, maybe is a good term on that. But the third one is an important one, isn't it? To make sure that they can't just artificially gaslight us about these exemptions. Yeah.
And that one has morphed a bit, to be honest. Okay. I think the other 3 are very strong and settled. That's still the core of the narrative. Religious exemptions are being abused. Well, I think it's transformed. Yes, God is still what they want to replace. Mm-hmm. You know what I mean? They want to replace our faith. They want the state to be God. They want medicine to be God. Anything but God. And this is
another path to affirm that. Yeah.
But they're not so worried about religion being in the way anymore as they are parents.
Okay.
And
goal and parent. Yeah.
They will go. They know that they cannot stop the religious parents. They want to go around them. So they're coming into our schools. Yeah. They're coming to our children with messaging for our children, with providers to care for our children's desires. So that one still exists. Yeah. Absolutely. I mean, West Virginia is still fighting for religious exemption. Yeah. Massachusetts today is still fighting to keep their religious exemption. That's still a real battle. But all that to say, if you distill down what the narrative is, who can influence those things, and how do we give people a really meaningful message that they can use to influence policy?
So how did you find, specifically once you got into this incredible group and you got connected with these folks who were doing the work that so needed to be done, specifically for you? Because I love how God does this. We each have our experiences, our educations, our professions, and all that together. That serves to build the team, right? That serves to build the community and the collaboration. That's why we're here together, right? Because we need each other in this movement to make this happen. So for you specifically, with your background in law, when you got here with these other influential, impact-making, freedom-fighting, let's actually do something for our kids, how did you how did you carve out your role there in advocacy and voice and the legal component of it? Like, I know it's probably the least comfortable thing to do is to have you tell us more specifically about your role versus the large movement. But I want to do both today. I want to really get to know your role in this while we also share the large movement, because I know so many of the moms and dads listening to this are like, I feel like I could have a role in this. I feel like I could have a job on this team, but they don't know what it is. They don't know how to define that role. So I think your case study, not into just the entirety of the movement, but you, Leah, I think your story has a lot of power to this. So how did you choose to use your, what God gave you?
Mm-hmm. So first of all, I was responding to a nonsense policy. So I knew we were looking at policy work, public health. Public health is intruding on our lives. Government overreach is a big problem. So that was kind of the zone we were in. And then looking at what was happening, we knew that the people needed a voice. And if you look at, regardless of your political leanings, any meaningful lobby has a voting block.
Okay.
And health freedom didn't. We didn't have a voting block.
So voice. Okay. So is that what you mean specifically when you say voice? Like there's literally nobody really, the voice we have is small, non-unified, just non-existent?
Well, I mean, we were not showing up as stakeholders in public health. So if we aren't at the table as stakeholders in public health, the people, the moms, the dads, then how can we blame our policymakers for only knowing the industry story?
Boy, a real simple analogy I can have with this, which is a fun story about my kid's school, because you're absolutely right. They're coming for the kid's school, and I sit on my kid's school board, and the leader of our kid's school is amazing. So anytime this stuff comes around, he's incredible. He comes to me, we have a chat.
You're a resource.
He is, yes, absolutely. And it's such an incredible thing, the way God has, and for him, again, he's not a natural health chiropractic advocate. He's not homeschooling and growing his own granola, growing your own granola. I don't think you can do that, but he's not making his own granola and bone broth, but he is saying this is a Christian school. Religious freedoms are this man's life's work, right? Mm-hmm. Hold the line, stand firm. So anyways, where I was going with that is it's so interesting because the story he always tells is like, oh, there's supposedly this, uprising of people that are upset with the policy the school has put forth. And then we ask him, has anybody come to talk to you about it? Not one. Not a single parent. So this is just the way of parents, isn't it?
Organized.
Right. We will get, and it's for some reason, it's our natural DNA. We will chat over here, we'll gossip over here, we'll comment over here, but we forget to take the only influential step that it is, which is to unify our voice, get together and get a seat at the table. So that is what you chose to take charge of, huh?
And how do we expect people to know the information that we know if we haven't told them? And so just talking about schools, that's one of the spheres of influence that matters most with health freedom. I mean, what are the environmental exposures for our kids? What defaults? What are the teachers? What seeds are they planting? And even their curriculum about vaccines save lives. My kids came home one day and they said, Isaiah was in second grade. And he looked at me with big eyes and said, Mom, you're never going to believe what Miss Dixon said today. And I said, what, buddy? And he said, she told us that the reason that we won't die from disease like George Washington is because our parents love us enough to get us vaccinated.
Wow. That is a reach if there ever was. Just weaving in a history lesson. It's sort of a made-up biomedic. It is,
classical
right?
Christian school. And I looked at Isaiah and he said, Mom, please don't yell at Miss Dixon.
Yeah, because it's not her fault. I mean, you know what I mean? Somewhere up the line, they sold her that message, yeah.
I mean, she's honestly, she means no harm.
None.
But... None. Oh, what? I don't love my kid. You just taught my kid I don't love him. Yeah. But like you said, it is knowing that we are a resource for the people who are making policy decisions, whether that is your school policy, your community libraries policy, your hospital's policy, your town. Are they going to fluoridate their water or not? Your town's making that decision. Are they going to put towers on your schools? And if you don't if you don't educate them on what you know, then you really can't complain.
No, you can't. And you got to just say, I love this. This is so powerful. You just got to be in that moment of being like, you got to have a huge heart of empathy and compassion for them. And you got to just go, into that understanding of they simply don't know. Because at one time, most of us didn't, right? At one time, we were all raised in that system and we had to break free from that system and we had to do our own research and we had to get to know. And somebody was that voice, that catalyst, that guide for us. And now we get the chance to go and be that guide and be that voice and be that support for someone else. Okay, let's do this for a second. Let's fly up to 30,000 foot view again. Let's just define, because I don't think there's anybody on earth who can define this better than you. Health freedom. Big picture, right? Before and then we'll go back into specific examples. Big picture. what does health freedom truly mean to you? What is the definition of it? And why is it so essential for us to really be aware of this and be all about this?
Yes. So we have a whole course on this at healthfreedominstitute.com.
Yeah.
But because what is health freedom? I mean, how do you tell your friend you care about health freedom?
Yeah.
Right. And that's what you were saying. People want to be able to carry the message. And that's why we exist, is to help people carry the message. And it's super simple. People enter this movement for so many reasons, but I'll be very honest. I was sitting in an airport one day during the whole escapade of mandated vaccines and masks and during COVID. Yeah. And this lovely flight attendant sitting next to me talking to her flight crew because the flight was delayed said, you know, some people just care what goes into their body. And I thought, you see this flight attendant? She can tell her team. She can tell her team why medical mandates are unacceptable and unethical and unnecessary. And can we make it that simple? And that's one of the reasons why people join this movement, is because they simply care to choose what goes into their own bodies and to their children's bodies. You know, I care to choose what medical interventions my kids participate in. And that's health freedom, is a basic human right that's constitutionally protected. And
it's, you know, even just at that foundation of that foundation is, especially as Americans, we choose to have a choice. You know, you can kind of just start there too and say, okay, well, this, especially when it comes to our own body, especially when it comes to the health of our children, you know, that choice is the most foundational right we can have. And if you take away choice, let's not even move off that word. If you take away choice regarding anything, goodness gracious, that is a slippery slope that none of us actually innately, authentically want to go down, right? Because all the roads that leads down are not good roads at all.
And that's, you know, when Benjamin Franklin, our founding father, was leaving the building after a month of writing the Constitution, this woman stopped him and said, you know, Benjamin Franklin, what type of government did you leave us? And he said, a republic, ma'am, if you can keep it. And I think that's where we as Americans have kind of lost our way a bit, is we aren't educated enough to keep our freedom, to know. And that's Stand for Health Freedom exists because we don't expect you to be a PhD in civics. They're not even teaching civics to our kids anymore. And so we are here to unravel the civics and help you be acclimated again. But if you don't have time to learn what your state lawmaker has authority over and what your federal lawmaker, or what the difference between those two is, and what your town council has authority over, don't worry, because we're going to help you contact the right person at the right time with a message that they have authority over and that would be compelling to them. And that's why we've built the largest voting bloc possible for health freedom in the U.S., which exciting things have happened. People who are listening right now can relate with. We could go down win after win after win, but one of the recent ones is, without the people's mandate, Secretary Kennedy would not be where he is. I mean, through Stand for Health Freedom, together we sent over 150,000 emails to Congress in order to say, this is Trump's pick and he is qualified and you have to affirm him. And
150,000. And without your organization, that number, that's not the number. That, you know, whatever
people just don't know.
So I want to pull on this. So you just said a very powerful word there, the differentiation of it. You are very much so. Your organization is doing a different job than what I think a lot of people in the space would think. There's so many people that are like, I'm here to teach folks about the science of health. That would be my job, right? I'm more the neuroscience, neurophysiological, like, hey, everybody, this is how God designed our kids to be healthy. Here's the neuroscience behind it. Here's where the perfect storm and the medical system takes us off track from a health standpoint, from a science standpoint, from a physiological standpoint. Here's how we get back all track. That's all science. That's totally different than civics. That's totally different. And I think I made this mistake. You become so immersed in the science and understanding, I'm just going to stick with that word, understanding the science of what causes our kids to get sick and the science of how we get our kids healthy and how vaccines play into that and how medical, you know, just overreach and overloading plays into that. And you think that everybody that's in this space is fighting the science battle. And like, let's talk about that. That's not the only battle to be won. And in fact, you got no chance to have this conversation with people of influence about the science, about health, about this going on, if you don't play, I don't call it play this game, if you don't know this game and enter this space and get after it. So can you talk about how your organization is different than a lot of other organizations that have stepped up and been advocates? They more focus on the biomedical side. You focus purely on this.
So it's a very good question because two things immediately come to mind. Number one is without practitioners like you and people who are teaching the science like you, the freedom wouldn't matter. Yeah. I mean, it's the options. This is why this is a perfect marriage between health and freedom, is because without our health, our freedom doesn't matter. And without freedom, we have no health. And so but the second part is science is a very bad governor. Yeah. That it can be changed overnight. It can be bought and paid for. It can be corrupted, manipulated. And the industry has all the money to write all the science and to eliminate all the science they don't like.
For over 100 years.
Correct.
Since the Rockefellers.
Since the Rockefellers, which I just heard a very interesting story about Rockefellers, but which I love learning more and more. But so we can get into that maybe. However, science is a bad governor. And for that reason, we really hang our hat with policy influence on constitutionality and on data and common sense, the things that policy should be built upon.
Okay.
And with limited government and the primary government, the core of government staying at home, then our health freedom is intact.
Oh, give us that one more time, my friend. Okay. So science is over here. Policy, say, if you can, I'm being redundant because I just know this is not a space a lot of us operate in, right? Mm-hmm. It's kind of a foreign language in the best of ways for it. That's why your website is the most helpful. I'm just going to say it in my Iowa language. It's the most helpful website I've ever been on. Every single article I click on and I read, I go, oh, that makes so much sense. And then I go to a video and I go, oh, that makes so much sense. Because it's so different than the brain I think with, right? The science brain and the health brain. And so, okay, back to the policy. So the role and the function you play with Stand for Health Freedom is to get into those conversations.
So if we want health freedom to be strong, if we want to be able to make decisions for our own health and for our kids' health without government interference, without coercion, without do, which means you can only come in if you do this, right? Those types of things, then we protect 5 things. And those are God-given, constitutionally protected rights. That's free speech, access to information. So these are the policies we work on. Yeah. And these are the pain points we help people with. People want information because information is power. Yeah. And if we win the information war, all else will follow because there'll be an uprising when people know the truth. You are not only good at disseminating information, my friend, you are exceptionally good at instilling action from that information. Mm-hmm. I see your organization as an information powerhouse. I see your organization simultaneously as an action powerhouse. And I just don't want to tap on, I want to get into that second part because information, it'll fuel us up and get us going, but then we got to do something with the information and you're really good at that. So what are those 5 things? Well, action gives us hope. It does. As humans. Sure does. We are not here to scare you and allow you to crawl under the table and hide or go create your bunker and forget about the future generations because we have kids to help, right? That's what's up, for sure. So the 5 pillars of health freedom, that access to information, free speech, informed consent, the primary medical ethic, parental rights, religious freedom, and privacy. And some people might forget about privacy, but if we lose privacy, the technocracy, the powers that be, the digital passports, then we lose everything. Don't you think God knew what he was doing? I know this won't cut listeners. You won't get this out on the same day, but Leah and family are in Crystal Lake the day of, right? And we pushed this back. We pushed the recording, and I don't see that as ironic. I see that as just like God saying, like, you two keep doing this fight because today's the day they're rolling out the whole Real ID thing, right? And tried to just not trying, getting that down that road. I think that's kind of something. I was kicking myself. I was in, when was it? During the first cabinet briefing, the day before that, I was in Arizona with my kids on spring break. And you know who's there? Christy Nome. Oh, yeah. At our hotel. And she had guards around her, and she was in a tent with at the pool with the drapes drawn and stuff. And I was thinking, I don't have a good enough reason to go intrude on her right now. What would I want to talk to her about? You wouldn't know. The next day, Christy Nome said on air how necessary it was to comply with the Real ID. And I was like, oh my gosh, if I only would have heard this cabinet meeting beforehand, I would have went to that tent to help her understand what's at stake. But anyway, the Real ID, I did have a friend fly today. I don't have any flights until next week. It's like, dang it, I want to know what's going to happen. Because since 2005, 6, they've been pushing this deadline. I know. And my friend Lindsay said, went through security today, handed them my normal ID, and they said, oh, come over here, ma'am. We need to check your bags, swab your bags. She said, it saved me 15 minutes. My husband was still back there waiting to go through security, and I got through with my normal ID with a little extra inspection of my bag. So who knows
I'm assuming
if it's going to be enforced.
Yeah, it'll be.
Will there be enough holdouts to not enforce it?
Right.
Still hold out. If you're listening, don't get the Real ID.
That is so true. So often things are quite overblown versus how they're actually brought to life. Okay, so there's so many of those 5 things are so worthy of 5-hour conversations within each of them. In our work with a pediatric practice, goodness gracious, informed consent. Can you take us down that road? What is informed consent actually? Give us an example of when they pretend to have provided informed consent and they haven't, what it actually is, and why that's so important as a parent of a child in navigating the healthcare system.
Well, unfortunately, one of the reasons people enter the health freedom world or join these ranks is because they give a pharmaceutical product or participate in some medical intervention with a known effect, and they don't know that until afterward when they experience the effect and they have massive regret. And that's not okay. It's sad that patients are not told, this is what happens if you take action. Here's the actions you can take. This is what happens if you do nothing at all. Yeah. Here are the rates of success. Here's the worst thing that could happen if you do nothing at all. Here are your other options. The one size fits all medical approach doesn't come with informed consent, because in the allopathic big M medicine world, you are given a single solution for a diagnosis. And maybe I'm overstating that. You could speak to that more than I can, but it's staggering that we are forced into a single cattle line with everything that we go to the doctors for. And you know what one of my hopes is with this new administration is that instead of fixing big M medicine and making it everything that people think it isn't, that we define it for the public and they learn what its role actually is. So that they can use it or not use it differently. I agree with you wholeheartedly. I was feeling where you're going there. As a foster mom, so that these parents aren't showing up to their medical doctor with their white coat saying, here's my baby that won't sleep. My foster baby is having sleepless nights. Please fix it. Boy, okay. Where that's not the role of medicine. It's not. Is the leg severed? Is the heart stopped beating? Does the child need resuscitated? The role of medicine is very defined. Oh, it's very defined. So and it's very different that if it was used appropriately, it's extremely different than what we're asking them to do. I don't think I've said this. So this will be, we'll be well into the hundreds when we release this podcast. And I don't know that I've actually kind of painted this picture. So thank you for that. I might go on a little 3-minute rant about this because I think it's a good thing for people to know. A lot of times when we do the work that we do, my friend, I think like if someone were to just listen to it surface level, which that's kind of how a lot of people will take information. I don't think our audiences do, though. Our audience are deep learners. We're very blessed in that way. But a lot of the rest of the world is surface level listeners. So they would tap into your organization and ours, and they would say, oh, that's an anti-medical establishment. They would just paint us in a untrue picture. What we actually know is that perhaps the most broken component, and that's tough to say, there's a lot of broken components. So to rank the most, rank the dysfunctions of the medical system, that's a long list with a lot of highly ranking things. But probably the one I would put at the top is we're asking them to do a job. They have no training. Their philosophy doesn't fit this job. Their science doesn't fit this job. They have no clue how to do the job. Medical doctors are the fire department. Dr. James Chestnut taught me this analogy, and I've used it, and it's amazing.
When your house is on fire, you call the fire department and they show up, and it's axes and hoses and it's surgeries and it's medications because you are in crisis. Your house is on fire. So there's no let's take our time and figure this out. And there's no need to figure out what caused the fire at that moment. It is just blast it and shut it down. So medical doctors literally are firefighters. Now, the moment if they do their job, if they get there on time and they save the life, they save the fire, well, it's a mess, right? The walls are also everything, the carpet's destroyed, everything. And so now you call a restoration company, right? You call carpenters and restoration experts. And that is a totally different job, and it's a totally different profession, and it's a totally different philosophy. And so I went to school in undergrad with lots of people because that's what you do, right? Same with Nick. Like, you have a lot of classmates who are going into traditional medicine. They're going into big pharma. I have friends who are pharmacists and medical doctors and all the things. By the way, I'm going to sneak this in too. They are miserable, and they look 20 years older than I do right now because they know they work in a system. They can't stand it, and they'd love anything to get out of it and have the life we have. That's a little aside within a side. And so my heart breaks for them because they're being asked to do a job that the system doesn't support. Their training has nothing. And so I think we're asking our pediatricians to be proactive, preventative health experts. And this isn't even meant to sound harsh. They are clueless. They have no idea what to do with colic. They have no idea what to do with chronic ear infections. They have no idea what to do with autism. Other than a broken bone and medical crisis, medical doctors don't have training in it, and their philosophy doesn't fit it. And so all we need to do, literally, it's this simple, is we need to expand our team. We need to have different kind of doctors, and we should start with the nervous system first, nervous system focused chiropractors first. That's our first call. That's our first line of defense. And then if we're doing our job well, both in the home, I'm going to go there first, and then we do a good job as our natural health practitioners, the goal would be to never have to call the fire department, right? We want to know their number, 911, in case we need them, but we want to never have to call it. They will do an amazing job when needed. We have an incredible crisis, life-saving emergency medicine. My son's a medical miracle, that then allowed him to be a chiropractic natural health miracle. But geez, that's the truth. And so informed choice, coming back to that, they couldn't possibly provide informed choice, not only within the system, they don't know the other options that the family has, right? So informed choice only comes, parents, it only is going to come if you have multiple voices, multiple doctors and providers that you can speak to weigh out all the options. And so I think the informed choice one is a massive conversation, Leah, because there's not a single parent I've ever met who doesn't want to be the one making decisions for their family, who doesn't want complete information with which to make the decision. So the information that you provide and the informed choice, they go hand in hand. You can't have informed choice without depth of information, right?
Right. Well, and that's the beauty of you empowering your patients to be their own doctor when they can be. You know what I mean? And so it's empowering people and moms. My heart burns for mothers to know that they are everything their child needs. That first and foremost, do not question your gut and your intuition and your God-given instincts on what it is that your child needs. And when you have a pause, you need to take that pause and investigate and figure out what it is that your options are, because otherwise you can't unring the bell. I mean, you can unwind, you can go and unwind the perfect storm. And I'm sure that
not have to.
You would be the first one to tell people that it's way easier not to have to go. I mean, we all have a perfect, you can talk to this
my dream,
on some level.
My dream is to not have my job one day. My dream is to not do a perfect storm workshop. My dream is to put myself out of work. Literally, I'll find something to do. I'm an effective farmer. I'm a good lawnmower. I can handle landscaping. All right. These are perfect lines. I'm a chiropractor. Things will be aligned. Bad joke, but serious. I would love to be just a wellness doctor, just a proactive doctor. The perfect storm job is my, favorite / least favorite job for sure. And it usually comes from this whole long path of lack of informed choice, lack of information. That is 0% the fault of the parent. 0%. I mean that number on its nose. And it is 100% the fault of the system that just did not provide information, shoved them down this place, took their rights away, and forced these things into it. And that might sound like a heck of a statement right there. And it's true. So let's go into this stuff. I kind of call this rapid fire, but by no means, my friend, do you need to give brief answers to this, because I don't know anybody else on earth who has the depth of understanding that you do in this place. Okay. So what are some of the most important rights that parents, unfortunately, don't even realize they have? Oh man, how good was that? Leah brings the truth with grace, experience, and fire, and I hope it gave you clarity and conviction around why standing up for health freedom matters so much. We truly do have a responsibility as parents to protect our kids' bodies, minds, and futures, and that starts with being informed and engaged. In the next episode, we're going to shift into action mode and talk through what parents can actually do to make a difference in your home, your school, in your community, and in your family. So make sure to subscribe and stay tuned. And if this episode lit something up in you, share it with a fellow parent or doc or provider who needs to hear it too.